Hello, welcome to my channel. My name is Nurse Pauline RN. I hope you're all keeping well. I hope you're doing great in your studies. Today I'll be talking about medications. All these answers will be on your fundamentals exam and in your final exam and in your NCLEX examination. Please hit the like button, the thumbs up button, and please share. Thank you. For medications, we will not forget to check your patient's ID bracelets and allergy bracelets. Before you administer your medications, you'll do the 5 rights: the right patient, the right medication, the right dose, the right time, the right frequencies, and route. The students who are nursing students should always have a registered nurse when they're administering medications. Document all your medications immediately after you give it to the patient. You document your pre and post pain assessments. If patient is unable to swallow, communicate to the doctor why you're not able to administer the medication. If your patient is unable to swallow oral medication, crush the medication if it's crushable with applesauce. If the patient is unable to swallow, we will do a consultation for a speech therapist. Educate your patients about the side effects of the medications and contraindications. Your patients have a right to know the side effects, all about the medications, and have their questions answered appropriately. Before you're administering medications, for example, blood pressure medications, please check your blood pressure. If your blood pressure is too low, if you have to hold it, let the doctor know why you're holding the medication. Some medications like the digoxin, you cannot administer that medication if the heart rate is below 60. You have to check the heart rate, and if you have to hold, please notify the doctor. If your dosage is incorrect, please, if you think it's incorrect, please communicate with your doctor. If there's a medication error, please assess your patients, do your vitals, assess for decreased loss of consciousness. If patient is symptomatic, we'll call the meds team. If there's a medication error, notify your doctor, complete an incidence report. Incidence reports are not in the nurse's notes. We complete our incidence report in the computer. Patients who refuse medications, they have a right to refuse. Please use therapeutic communication with your patients. Use open-ended communication. We need our patients to be compliant when it comes to taking their medications in the hospital or at home. We need to know why the patient is refusing the medication. Sometimes after explaining it to them, they will take the medications. For some reason, some patients think the nurse is the one that's ordering the medication. But if you tell them the doctor is the one who ordered this medication, most times they will take the medication. Remember, when you are administering insulin or heparin injection, remember to rotate the site of your medications. Routes of medications, we have IV, oral route, sub-Q route, subcutaneous route. I am intrathecal root that's around the spinal cord. We have sublingual meds, we have rectal meds, we have suppositories, we have ocular, eyes, and otic for the air. We have nasal sprays. We have tropical ointments for the vaginal and rectal area. When you're administering eye drops, wait 5 minutes after before administering your eye ointment in the lower conjunctival sac, inner to outer canthus. For inhalation therapists, that's done by the respiratory therapist, that's your neb treatments, your inhalers also for patients with asthma or COPD. Stat orders mean now, right now, stat. Single doses orders are one-time order which is then discontinued after you administer the medication. Standing orders are carried out until when the doctor discontinues this medication. PRN, these are your as needed medication. Example, your pain, your nausea medications, maybe sleep medication at nighttime, maybe patient is agitated, those are PRN orders. Drug allergy affects the immune response. Occurs when the body interprets medications as foreign. So make sure your patients are have their allergy bracelets on. Any allergic effects, do your assessments, patient symptomatic, you call the meds team, notify the doctor about this allergy. Anaphylactic reaction is life-threatening. Some people have bee stings. You're familiar with that. It causes respiratory distress, bradycardia, bronchospasms, cardiovascular collapse. Call the meds team for patients who are showing symptoms of anaphylactic reaction. Some people will show anaphylactic reactions during blood transfusion. A teratogenic drug is one that has the potential to cause developmental defects in embryos or fetus. Meds should be given, read your instructions with food. Before eating, some medications will tell you after eating, but giving medications with foods decrease gastric irritation. We are documenting our medications. We're documenting the name of the medications, the doses of the medications, the route of the medication, the name of the nurse who administered the medication. Did your patient refuse the medications? You are documenting that also. We're documenting medications errors with an incidence report that's not entered in our nurse's notes. Medication errors, we have wrong patient, wrong dose, failure to give it at the prescribed time. Those are your medication errors. Know about your medication, know about the usual dose, the adverse effects, know about the routes and the actions. Know about incorrect preparation of your meds. Read your labels or to prepare your medications. Giving medication that has deteriorated, read your labels. Read your expiration date, especially on those insulin bottles. Insulin, R is for regular, that's your clear. N is for NPH, that's your cloudy. Remember the word RN. R before N. You'll draw up your R first, then you draw up your N. That's RN. When you give IM injection in the deltoid, do not give more than 2 ml. That will cause irritation to the arm and excessive pain. Scored tablets, you'll break in half. Enteric-coated tablets decrease irritation in the stomach. Patient has a right to be informed about the medication given, the purpose of the medication, the action, potential side effect before administered. Patient has the right to refuse. Assess history of allergy. When you're given medication in an NG tube, a nasogastric tube, make sure you flush the tube with water before and after. It's a great pain when those tubes are flushed because nurses come behind you. They are unable to give the medications, especially on the weekends when there's not enough help. We need these medications to be clear, because if we mess up the NG tube, the GI tube, the G tube I'm talking about, sometimes the patient have to go back to the OR to have a new tube placed. Next, we have patches, nicotine patches, pain patches, lidocaine patches. That's your pain patches. Clean the site before administering and rotate your sites. Practice aseptic techniques before and after administration of your medicines. Doctors order medications. Nurses are the ones that give the medications. In a court of law, nurses are responsible because you are the one who is giving the medication. Question any order you think is incorrect. Call the doctor before giving it to the patient. Keep all narcotics locked away. For narcotics, we will have to have a second nurse be a witness before we give it to the patient. Both nurses will be signing off on this medication. Use medications that are clearly labeled. Check expiration date. Never leave medications at the bedside. If your patients are in the bathroom, if your patients are praying religious rites, exit the room, come back maybe half an hour, give it to the patient. If the patient is oriented times 4, do not leave without watching the patient swallow that pill. You cannot check it off as being given when you did not witness the patient swallowing. Some of the elderly, they cheat their medications and they do not swallow. If your patient is having difficulty swallowing, crush their meds if it's crushable in applesauce. If they're not able to swallow it that way, the patients will have to have a speech therapist. Consult, communicate with your doctor. Some medications are one-time medications. For example, patients going to the OR or having a procedure, they will call and ask you to administer the medication before sending for the patient. Oral medications are the easiest medications to be ordered for the patient. It's the most desirable way to administer, and it's the most convenient medication, the oral ones. It's safe and it's less expensive. Never crush enteric-coated medications. Never crush sustained release medications. Eardrops, for adults, you'll pull up and back. For children, eardrops, a child, you'll pull down and back. Your antitussive medications are your cough medicines. Your antacids are for your stomach. Your anticoagulants like aspirin, heparin, Plavix prevents blood clots. Your antipyretic controls temperature, for example, your aspirin. Your tranquilizers decrease anxiety. Most medication metabolizes in the liver. Some medications metabolizes in the kidney. Medication adjustment may need to be adjusted for renal patients. Check with your doctor, please. Nurse should never increase your IV rate. If you are behind, do not play catch up. Communicate with your doctor. Let your doctor know you're playing catch up, and your doctor will give you orders. We're talking about side effects of medication. Most frequent side effects are nausea, vomiting, diarrhea, dizziness, constipation, itching. Side effects of medication: decreased blood pressure or increased blood pressure or increased glucose. Check side effects of medications. Know your side effects before administering. Check contraindications of medication before administering. For patients who are receiving vancomycin IV, sometimes when the patient gets to the fourth vancomycin IV to be administered, the doctor will ask us to draw a trough level. The lab will come in and draw that trough level. It's a blood drawing. The nurse should not administer the fourth dose until when you check the result of the trough level. Sometimes they say if the dose is greater than 20, do not administer, but just go according to your doctor's orders. Some facilities are careful about the use of abbreviations on medications. Please know your hospital or facilities when a patient is discharged. Sometimes the doctors fax medications to the pharmacy. Sometimes we deliver prescriptions in their hands. Make sure patients are educated about their prescriptions. Let them know, do teaching, let them demonstrate back, let them confirm to you that they have understanding of their medications, also the family. For medication reconciliation, that is completed on admission. If patients have additional medications they did not tell us about, add it to your medication reconciliations. On your admission, please document on your medication reconciliation if your patients are taking medications, if they are taking dietary supplements at home or over-the-counter medications. Remember, ampoules. When you have ampoules, you use a gauze around the mouth of the ampoule, or you can use maybe 2 alcohol pads, wipes, hold it around the end of the ampoule and just snap off that top of the ampoule, or you can hold the ampoule and snap it away from you backwards in order to open the ampoule. Okay, that's all I have for you on medication. Please hit the like button, please hit the subscribe button, please share my video, and have a blessed day. Thanks for your time. Hope you're doing well with your exams. Thank you.